Hey guys, today we're going to be talking about schizophrenia, which is its own branch. It doesn't classify as a mood or anxiety disorder, it's its own thing. So, 1% of the population have schizophrenia, and there's several different types of schizophrenia, and not all schizophrenia is going to look the same, or not all schizophrenia is going to pop up around the same time. For women, it usually presents itself in the early to mid 30s. For men, late teens to early 20s, and there's even a type of childhood schizophrenia. So it's not going to look the same for everybody, but they all have similar characteristics. Uh, so here is the definition. It is a psychotic disorder characterized by hallucinations and delusions, apathy, thinking abnormalities, and split between thoughts and emotions. So this is not multiple personality disorder. The two big factors that make it schizophrenia are hallucinations and delusions, and those are different. Hallucinations are false sensory experiences. So you might hear things, see things, smell things, touch things that aren't there. While delusions is thinking and believing abnormalities. So this is going to be, if you feel like you hear aliens, that's a hallucination. If you think you are an alien, that's a delusion. So like a false thinking belief is a delusion. If you hear God talking to you, that's a hallucination. If you believe that you are God, that is a delusion. So they're also going to have inappropriate emotions at different times. So that's like the split between thoughts and emotions, that they're just, maybe they might laugh when they are angry or cry when they are um, well, in inappropriate times. Cry when everyone's laughing, they are crying. So it's going to be a little bit of uh, not lining up thinking and emotions. There's going to be two different types of symptoms. So, symptoms, and this really goes for all disorders as well, but you're going to see a lot of positive versus negative symptoms in schizophrenia type questions. So, positive symptoms is the addition of a symptom that normal people don't have. So, hallucinations or delusion is a positive symptom. Normal people don't have those, and schizophrenics have the addition of those symptoms. While negative symptoms is a symptom that you should have, like you are lacking a characteristic that people that are mentally healthy do have. So think about like apathy. You are lacking the you're lacking sympathy, you're lacking empathy, you are apathetic, you have no feeling in that way. So it's something that you should have had or you should have, but you don't. So there's four different types of schizophrenia. There's paranoid schizophrenia. You feel like your hallucinations and delusions are either out to get you, you feel like you're being followed, maybe being watched, and you just feel like you're persecuted by some sort of force. There's disorganized schizophrenia, where it's the main symptom here is the thinking abnormalities. Their thoughts and words are not organized in their brain. They actually might have something called it's called word salad. So where when they talk, they're saying words, but the words together don't really make sense in a coherent like thought pattern. Each individual words, it's almost like you're going through a dictionary and you're just pointing words and you're just saying them. It's like you're not really making any sense, that you're saying things, but what you're saying doesn't really make sense. So it's disorganized thinking. There's catatonic. I'm going to also post a video right underneath this one of an example of catatonic schizophrenia. This has to do with their movements. So I have a picture. Hold on, right. So you see this person in the wheelchair, they're like stuck. So the catatonic schizophrenics they have like a waxy flexibility of where you almost can pose them in different like positions and they'll stay that way. Or catatonic schizophrenia will be more of a speech pattern where they are going to repeat things like a parrot. So they might say the same words over and over and over again and repeat like a parrot. They try to say something different, but the only thing that comes out is their repetitious speech pattern. And undifferentiated just means it's type of schizophrenia, but it doesn't fall under the previous three. So it's more like miscellaneous schizophrenia. So maybe they have hallucinations and delusions, but they're not paranoid, or maybe they have thinking abnormalities, but not to the point of being only disorganized schizophrenia. So what happens about like what causes schizophrenia? There is some sort of biological component here. There is a hypothesis, it's not proven yet, but there is a link between overuse of dopamine, overactivity of dopamine, and schizophrenia. So the medicine prescribed for schizophrenics are going to try to lower their dopamine. Um, you can have a brain. I have a picture. I'm just trying to get the picture. Okay, there you go. The brain anatomy of a schizophrenic is different. Their cerebral tissue, their four lobes are kind of shrunken. You kind of see in this. I can't move my mouse. I don't know where my mouse is. Oh, there it is. Ooh, I lost it. Oh, there I am. So you see this picture above me, the schizophrenic brain. You can kind of see like the wrinkles are a little bit deeper. The butterfly, the shape in the middle of the brain, where there's this little space there. It's bigger on the schizophrenic brain because overall the cerebral tissue is kind of shrunken. They have a smaller thalamus, which is, remember, that's the very top of the brainstem. It's like the post office of the brain. It sends and receives neural messages. So what could cause this brain abnormality? Possibly low birth weight or any birth complications. There is a story of a small town, I believe it was in Austria, I think, don't quote me on this. Like during World War II, there was a blockade, and the small town didn't get any like supplies for like 2 years. Like barely got any food, didn't really get any supplies from the outside world. And the women there, um, the women that had babies, they were like 10 times more likely to develop schizophrenia in their lifetime because the women were so malnourished that their babies were underweight, and their babies' brains on average were smaller than a typical person being born. So while the rest of the world was at a 1% schizophrenia rate, in this small town those 2 years was a 10%. Those babies, a 10% chance of developing schizophrenia. Genetics. If your parents or grandparents develop schizophrenia in their life, then you're more likely to. I think it's something like if both of your parents have schizophrenia, you have a 50-50 chance of developing schizophrenia. Cannabis consumption. So this is marijuana, which increases your levels of dopamine. And there was a study that says regular use of marijuana increases your chances of developing schizophrenia by 6 times because your brain is still developing in size until the age of around 25. So if you are like if you're using too much dopamine, if you are smoking marijuana, you can stunt your brain growth, or basically the over usage of dopamine is going to potentially lead to developing schizophrenia. And if your mom has the flu during her second trimester, like so, um, 9 months of pregnancy. First 3 months is first trimester. The second 3 months is your second trimester, and your last 3 months of being pregnant is your third trimester. So those middle 3 months, if your mom this is where the main developing of the brain is happening. If your mom develops the flu or she gets the flu, you're more likely to develop schizophrenia. So what's the treatment here? Chlorpromazine is the most widely used antipsychotic, which is it's a drug that's like, so there's antidepressant, there's anti-anxiety. If it's really schizophrenia, it's going to be antipsychotic. And so if you produce too much dopamine, chlorpromazine is going to block those dopamine receptors. So you're still producing it, but it's not being absorbed. So remember, there's two types of drugs. There was a agonist, which mimics, and there's an antagonist, which blocks. So chlorpromazine blocks. And you see the picture down here of it blocking the receptor sites for dopamine. And that is it for schizophrenia. We're going to talk about dissociative disorders later. Anyway, have a great afternoon, and don't forget to watch that video of the catatonic schizophrenic. It's very, very interesting. Anyway, have a great afternoon.